So I think this was as a result of a democratic vote. We asked our doctors who work on the front line, do they think that this latest offer is enough to call off industrial action, yes or no? And 83% of them, that's nearly 30,000 frontline NHS staff, said that it wasn't enough to call off this round of industrial action. My message is that we should start negotiating and the government should stop game playing, and what we should be doing is getting round the table immediately to try and get a solution which will see us stop turning tens of thousands of resident doctors who are fully qualified away from jobs in the NHS, and also value doctors to stop them from leaving the NHS rather than the Health Secretary pushing real terms pay cuts onto doctors in just a few months' time. You talk about the public, but let's talk about patients. When I have to ask patients in my A&E corridor to just stay in the A&E waiting room for another few hours because we don't have space in the department, because we don't have enough doctors, those patients are really quite upset at the fact that we turned away 13 fully qualified doctors away from A&E training jobs this year. And when I have to continue to provide oxygen in bottles to patients on corridors that I treat, those patients are absolutely blown away to find out that we are about to turn about 30,000 doctors away from jobs in this country. That is clearly a bonkers situation to be in. And what we're asking for is to get round the table and get a credible and real decent fix to that problem. This set of strikes, and every set of strikes to come for the next few years, is entirely avoidable. Nothing is confirmed, nothing is absolutely happening. Our members, who are frontline doctors who have spoken on this issue, but if the government got round the table tonight or tomorrow to negotiate a fair and credible deal to end these disputes, then we would call off industrial action on Wednesday. I don't think there's anything unrealistic about asking for our pay to keep up with inflation next year, despite the real terms pay cut this Health Secretary is pushing onto doctors in a few months' time. And in addition to that, what is really, really unrealistic is to expect the NHS to continue caring for patients in the way that it does on corridors and not see morale drop even further and doctors leave this country. We think it's reasonable and we think it's eminently responsible to get doctors into jobs and also to value them by looking at a potential deal which would last a couple of years on pay, which could potentially see industrial action at an end to the NHS for resident doctors, overpay for years to come potentially. So, I was stood on a picket line in London during the last round of industrial action, and there were people who supported us and there were people who didn't support us. However, I think when you speak to people and you explain the situation, that we are turning tens of thousands of doctors away every single year, they are quite supportive. The media narrative is entirely focused on pay. Yes, we do not want a real terms pay cut next year. I do not think that is unreasonable, but this is also very much about jobs and doctors who are being turned away from jobs in the NHS. In the region that I work in, a coroner's report recently ruled that a patient had died because there were not enough specialists to deliver a particular life-saving stroke intervention, and yet this government is about to turn away thousands of doctors away from those specialist training posts, and as a result that care can only be delivered between the hours of Monday to Friday and 9 to 5. I think that is an absolute disgrace, and I think that patients in this country deserve better care, and we need more doctors, we need more specialists, we need more GPs to be able to deliver that care. I don't think that's an unreasonable ask. On the 19th of November, I asked the Health Secretary, without any single strike date planned in the diary, to come to the negotiating table and negotiate a decent and fair end to this jobs crisis, and also continue on that journey to restoring our pay rather than U-turning by pushing real terms pay cuts onto doctors. My ask is for the Health Secretary to come to the table without the threat of industrial action to get a deal done.